Hello, everyone, and welcome back to ALEC TV. We're broadcasting here from downtown Atlanta at the ALEC 49th annual meeting. I'm so pleased today to be joined by State Senator Beverly Gossage of Kansas. And Beverly, you are kind of like, you self-described policy geek for all things healthcare related. Tell us about your background, because you go back all the way to the Bush years. You were an advisor to President Bush, is that right?
I actually worked with President Bush on pioneering health savings accounts.
Okay. Wow. And that is a huge issue that so many Americans today still benefit from. I have one in my employer. Yes.
Nice to hear that.
Yeah. So tell me about what is happening right now in the space of healthcare. What are the big issues you're hearing from your constituents in Kansas?
Well, a couple of things. The reason that I got involved with HSAs is because I have been a health insurance agent for 20 years. And as such, I saw that people were giving too much money for the insurance company for premiums. And insurance companies were covering things that people could just pay directly. And so by allowing insurance companies to not have a primary care physician included, why not just make those arrangements yourself and let insurance just cover the catastrophic things like they should in the first place? Why are you paying generic drugs that you can pay $4 in cash for instead of having that be part of your insurance plan? So the idea was to have a higher deductible. Back then, high was $1,200. And let's just say I'm going to pay for those small things out of an account that'll make my premium smaller. Well, as you know, what happened with the ACA is that in our state, for example, rates went up 400%. That hasn't gone away. It's kind of like what the federal government did, was say, sorry about this. We're going to break everybody's leg. Hang on. Some people are going to get a crutch and you're welcome. So we had most people, everybody with a private policy in the state of Kansas went up 400%. So a few people were able to get some subsidy, but most people did not qualify. Or if they did, their premium was $500 and maybe they got a $50 subsidy. That's completely unaffordable.
Right.
And so then the government just had to keep pumping more and more money because people were saying it's unaffordable. And as you recall, initially it was, what if people don't buy these very expensive plans? We'll force them to. And if they don't, they'll have to pay a fine. So there were people willing to go uninsured and pay the fine rather than paying for this expensive premium. So I've been trying to get more carriers to get involved. Now, that doesn't do a lot, however, because they're not really competitive. We're all offering basically the same plan. We're getting the same kind of subsidies. Only a few people can qualify. So one, in every state had and still do state regulations, right? In our state, children's policies were $25. Young people were $50 all day long. How could we have such a low premiums in our state? Because we were able to underwrite. I know if you say pre-existing condition, it's a dirty word, but you still hear, why don't I get some kind of a discount like I do with driving discount because I'm a safe driver? I take care of myself. I run every day. I don't abuse alcohol. I don't smoke. Why am I not getting a subsidy? Because your premium is only based on your zip code, your age, and your income. It has nothing to do with how well you take care of yourself.
And I think for so many of us in the conservative space, that sort of gets to our core belief in individual responsibility and making choices as an individual.
So whereas people have given up, even though we all know that the ACA was a failed experiment, it for the first time usurped the authority from the Department of Insurance in each state by taking over federal regulation on the individual market. Now we're seeing more of that because the ACA also said to small business owners, we're going to help you out here. These insurance companies cannot ask you health questions. They're like, well, then how do I know if you don't have five of your members that have stage 4 cancer, need a kidney transplant, or weigh 600 pounds? We have no way of knowing that. So here's your rate. So their rates went way up. So then they're like, please ask us the health questions. Only way they could do that was level funded, self-funded. That used to be only for the large sprints or the large carrier, the large companies. So now we have what's called level funded, self-funded. It's where they can get the health questions. Some of them are starting to see their premiums go down. But what did that do? Now the departments of insurance on the state level, those are called ERISA plans. So they are not subject to a premium tax, which did not really raise their rates from that would help go into the pool. So states have very little, if anything, they're regulating when it comes to the health market. So two things that I'm fighting for. One is let's let small businesses, whether they have level funded, self-funded, so they're not really taking a risk here. Level funded, self-funded plans should still be under the regulation of the state rather than under ERISA, which doesn't give the state any regulation. I would love to see us peel off that Obamacare regulation and leave the state regulations that we already have. Again, the reason we were having such small premiums in our state is because we allowed underwriting. So you did get that healthy discount.
Right.
And therefore, you're encouraged to buy a policy before you needed it, right? Isn't that the purpose of insurance?
Yes.
Get a policy on your house before your house gets on fire. That's how it's supposed to work. Same thing with your car. So people will say, what about a child that's born sick? You have 30 days to add your child onto your plan. No underwriting.
Right.
Okay, that was already taken care of. What about people who did wait until they got sick?
Yeah.
Good question. Those people could still get a policy. Our state funds paid none of that. It all came from a small premium tax from each of the carriers based upon the percentage of the population that they had members. So they would pay into this pool called the high risk pool. Sounds like a dirty word, but it wasn't. And so if you said to me, I should have got insurance, my mom's mad at me that I didn't, but now I have this condition. Okay, I'm sorry, that's such a severe condition that unfortunately none of the carriers will take you at this rate. But you're automatically, if at least two carriers declined you, you're automatically allowed to go into the high risk pool. Yikes, what are those rates? They're 150% more. Well, if you're 30 years old and your premium was $50, okay, 150% of that now, your premium would be $150 instead of $50, right?
Yeah.
Okay, well, that's doable because now on the exchange, it's $250 or $300, right? Did we need a subsidy? No. How much of state funds went to the high-risk pool? As I said, none. Out of 3 million people in the state of Kansas, how many people do you suppose were in our high-risk pool? I get 100,000, 20,000. What would you say?
3 million people in Kansas total. How many are in the high risk? I'm going to go with 20,000.
1,200.
What?
That's it.
1,200.
1,200.
That's tiny.
And they were in and out because you may have somebody like, gosh, I'm pregnant. Okay, well, they're not going to take a pregnant woman due to the risk.
Right.
But you're guaranteed a policy here.
Gotcha.
You're going to pay a little more.
Okay.
Once your baby, and you can add your baby on. Once your baby's born, you can just buy a regular policy like everybody else because you're no longer at high risk.
Wow.
So they came in and out of that program. It worked beautifully. We had no complaints, but we were forced to adhere to the ACA. So all of the things the ACA had said insurance must cover caused our rates to go up by 400%. They were covering things people didn't want.
And that is exactly the point of ALEC, and I'm hearing that repeated over and over again, is states are trying to be in charge of their own destinies, and then they're fighting with these federal bureaucracies that are overlaid on top. And states are saying, wait, we've got our solution. This works for us. We don't want all this federal mandates coming down on us.
So we have not expanded Medicaid, yet we don't have any more people uninsured than any of the other states do. We don't want that. We don't need that. We know that the people that are currently in our Medicaid program are having a hard enough time trying to find a doctor. And they're the people we know that should be in the program, the disabled, the low-income seniors and families and pregnant women and children. This is who should be in it. Because we haven't expanded, those folks, about 12,000 people that are currently getting a policy for zero premium because they're at that poverty level of 12.5, if you work at McDonald's, leave 20 hours a week, then you're going to make about $12,500 a year, which your premium would be maybe $5, no premium at all. And your generic drugs are no cost, no charge to see a primary care physician, and $5 to $15 to see a specialist. Total out of pocket of $250. How do I know? Because I'm certified to write those plans for people. So why would we want to take these 12,000 people that are getting these amazing rates on a private policy, costing Kansas nothing, even though our dollars go to the federal government, but currently out of our state general funds, it's not costing us anything. Why would we want to expand Medicaid, force these people into Medicaid because they lose all their subsidies? So now the premium's $400, $8,700 out of pocket, and they're competing with those folks right now on Medicaid who have a hard enough time getting a doctor.
Yeah. And Senator, while you're here at ALEC, is this a message that you share in these various working groups and task force with other states? Are other states facing similar issues, and how are you able to network and help and share ideas here?
I'm glad you asked that, because what I've done is shared how to explain why you don't want Medicaid expansion, because the hospital associations, God bless them, want this because they get a higher reimbursement level if they have more people in the Medicaid expansion world.
Yeah.
And so they want this, but it's only going to harm people.
Right.
And also, therefore, they're like, we need talking points. We don't know how to explain that. So I've written out step by step how to explain it, because if you really care about the people in your state and you care about the people that are on Medicaid now, the last thing you want to do is expand Medicaid. So give them talking points on how to do that. And then we as states need to speak up to the federal government about, you are usurping more and more of our regulatory authority.
Last question for you. What is the benefit for ALEC, for your constituents and for the people back in Kansas? How does coming to this ALEC annual meeting benefit them?
Two things. One, I don't know if you know, but I used to be a speaker at many of these ALEC conferences back in the day. Happy to speak to them. Love ALEC. This is before I became a legislator. And so coming and meeting these legislators and watching these people sharing ideas, they are desperate to take something back to say, well, they're doing this in Kansas or doing this in Texas, or they're fighting this in Florida, to where you're like, did you write legislation on that? Or how were you successful in pushing this back and getting this away at the door? And this is the place to find that out. This is honestly, I go to other CSG and NCSL, and just to name a few, NCOIL, National Conference of Insurance Legislators, of which I'm a member, and serve on their health committees. But there's nothing like ALEC. There just isn't. I mean, you walk in and you feel at home, and everybody feels comfortable to share their ideas. And we have people from all stripes here. It's very bipartisan, and lots of people are able to come. But let's be honest, you can share some information with people that you feel like we're of the same ilk.
Right. I mean, I think we all share those same core values of limited government, federalism, free markets.
Yes.
And when we have that in common,
Right.
it's more of like a safe space to say, hey, how within those parameters, what ideas do you have?
Right. Because when you're in your state,
right,
you have lobbyists that are at your door all the time. I'm the vice chair of our health committee. I serve on the insurance committee, which all makes sense. I'm a former teacher, so I'm on the education committee. I serve on lots of interim committees like 340B and other programs. Everybody wants more money.
Right.
Senator, we could do more if you just would fund this. I love the word invest. I actually hate the word invest, because the word invest means take more taxpayer dollars to fund that, and here's why it's a good idea. So I have to say, no, I don't think the taxpayers would want me using their money to do that, because there could be a private solution for this.
Yeah.
If this is a problem, then let's talk to private. For example, in the Catholic Association in Kansas, every year would come up to support Medicaid expansion. We met together and like, wow, everything you said makes sense. What can we do? I'm like, you guys already do so many things. Let everybody know what you do. People come in and get a $5 mammogram at some of your community centers. Let's talk about where they can get actual health care as opposed to a Medicaid government bureaucracy program. And what is that costing the state? Nothing. So you guys offer all of these private solutions here that people need to know about. And how can we get people, the public, to know that? So again, these are all ideas that we can share with each other. And I said, when you are a state legislator, sadly, two things. One, federal dollars look like crack cocaine. Oh my gosh, we need more of that, right? There is a big bag of money sitting in Washington, D.C. that says Kansas on it that we're just not taking advantage of.
That's exactly how I, as a taxpayer, think that it happens.
Which is ridiculous.
Yeah.
Okay. Then the other thing is, you have lobbyists that can convince you very easily that don't you care about people? And if you did, don't we want to do this before it gets worse and then you have to pay even more? Let's back up a little bit. If you're a state legislator, you're thinking government, and you've got a big hammer that says
Yeah.
government, and you're looking for nails.
Right.
And every problem that's presented you, whether it's a real problem or not, you want to hammer with government. And maybe government's the problem, and maybe we need to look what caused this, and maybe government caused this. So more government's not the answer.
Well, you are a breath of fresh air. Thank you so much, Senator Gossage from Kansas, to come and share your ideas and your policy solutions for healthcare. This is such a timely topic, so for sure, it's important. Thanks, everyone, for watching this segment of our ALEC TV video broadcasts from Atlanta, Georgia, at our 49th annual meeting.